the agenda for the 83rd legislative session presented by the Texas Council of Child Welfare Boards and TexProtects, the Texas Association for the Protection of Children. Should you have any audio issues, if you can't hear us very well on your computer, there is a call-in number, and you can see that information on your screen. We will also be recording this presentation and have the PowerPoint available for you, both on the Child Welfare Board website and the TexProtects website. Feel free, if you have any questions, to type them in the chat box as we go, and we will answer them at the end of the presentation. And Diana, I'm going to hand it back over to you.
All right. Thank you, Ryan. I'm Diane Martinez. I'm Director of Public Policy and Education for TexProtects. And we have partnered with the Texas Council of Child Welfare Boards to do a series of webinar presentations during and right before the legislative session. We did our very first one on advocacy, then we did the next one on the budget, and we did kind of a budget 101, and now we are going to do one on the legislative agenda and some key folks this legislative session. And so we will launch next into the presentation. I'm going to try to keep this to around an hour, so we won't take up too much of your time today. Obviously, if you have any questions, you can type them in the box, or you can email me directly, and we'll be happy to assist you with any questions. If you want to sign on to the Child Protection Roundtable legislative agenda, you can contact us afterwards, and we can provide you the form to do that. So let's get started. So as many as you know, TexProtects, we are a statewide membership-based advocacy organization, and we advocate around three core areas. That first one is, of course, child abuse prevention. You know, our whole thing is that if we can stop these kids from coming into the system to begin with, from being abused to begin with, that's what we need to be spending money on, and that's what we need to be concentrating on. Our next one, of course, is improvements to those systems that impact abused kids. So the Child Protective Services system at the Department of Family and Protective Services, also the criminal justice system. Children are witnesses many times in trials, so issues around that, witnesses around strengthening laws for criminals that hurt children. And then our third prong is looking at the programs that help abuse victims. Now, one of the things that we do is we facilitate what's called the Child Protection Roundtable. And we created that roundtable, and we facilitated really to try to bring the advocacy community together. And these are missions that have, as part of some of their mission, child protection. Many of them do other things besides that. But as long as it's part of their mission, then we really try to get on the same page with everyone. One thing that advocates have found through dealing with the legislature is that if you're not all kind of saying the same thing, then members tend to not do anything. And so we have strength in numbers. Our goal is to generate consensus public policy items and then try to promote those and get those implemented. Not all the work the roundtable does is at the legislature. We do deal directly with the department, the FPS, to try to get some things implemented non-legislatively, and we've had some success with that. We're very happy about that. But the main focus of the roundtable is the legislative public policy items. And the Texas Council of Child Welfare Boards is one of our members of the roundtable. We partner with them on quite a few things, and they have signed on to the legislative agenda that we will be going over today. To give you a little bit of history about the roundtable, it started up in 2008. We currently have over 40 organizations that are members of it, and we know when we first started we only had budget items. Now we have both budget items and bills. And then we have really two committees that do all the work. We have a Child Abuse Prevention Committee that's chaired by a former commissioner, Mr. Jim Hine. We have a CPS committee that looks at Child Protective Services. That's chaired by Sue Milam from the National Association of Social Workers. In order for an item to get out of their committees, they have to have a majority vote. So the full roundtable vote is 4/5, but not a majority vote, unanimous vote. To get out of the committee, you have to have an unanimous vote, which is a pretty high hurdle. So these ideas that we're going to present today that have been adopted have really been thoroughly vetted by the members. So one of the things I would like to talk about is some of the key committees that are legislation, both TexProtects legislation and roundtable legislation. What are some of those key committees? Because people will ask, who should I be talking to? Well, the most important person to talk to is obviously your senator or your representative. But if you have the ability to go and look at some of those other key committees, or if your rep or senator is on one of these key committees, it's very important to establish a relationship with them. So in the Senate, the most important, obviously, is the Health and Human Services Committee, which is chaired by Senator Jay Nelson, but also the Jurisprudence Committee. We have legislation goes to there. It's a very important committee, and that is chaired by Senator Royce West. The Education Committee, very important committee. Some of the stuff goes through there. That's chaired by Senator Dan Patrick. And the Criminal Justice Committee, that is chaired by Senator John Whitmire. So those are the main ones. Every now and then you'll see something go through another committee, but these are usually the ones that we deal with. So from that, the most important one is the Health and Human Services Committee. And the bulk of legislation in our area, child protection legislation, goes through Health and Human Services. So this is the list of the committee members on that committee, their districts, where they're at, their hometown. And so if you see this list and one of these folks is your senator, or if you know them personally, then you can be a big help with trying to advance the legislation that we're going to go over today. Almost all these members have been on this committee for quite a while. We do have two new members this session. Charles Swartner is a brand new member to the Senate, as is Larry Taylor. Charles Swartner was a House member. He hadn't been a House member very long when he became a senator. Larry Taylor had been a representative for quite a while before he became a senator. The rest of the members on this committee, Senator Zaffarini, Senator West, Senator Oresti, Senator Nichols, Senator Huffman, Senator Dool, and Senator Nelson, have been in the Senate for quite a while. They've been on this committee for quite a while, and they're very knowledgeable about the issues in this area. So our next key committee, looking at the House of Representatives, so these are the ones over in the House. So we have Criminal Jurisprudence, which is chaired by a brand new chairman. The chairman that had been there for quite a while left and went to Congress. Our new chairman is Representative Abel, and he is from the Corpus Christi area. Human Services is chaired by Representative Richard Raymond from Laredo, and we'll talk about his committee in a little bit. The Judiciary and Civil Jurisprudence Committee is chaired by Judge Lewis. Public Education is Representative Aycock, and Public Health is Representative Colcourse. So most of the things that child protection issues go through these committees. Health and Services Committee in the House is obviously the one where the bulk of our stuff goes through. The House breaks up public health and human services, and so public health, Representative Colcourse, committee gets more things dealing with doctors and hospitals and nurses. The Human Services Committee really gets those things dealing with child protective services, individuals with disabilities. Those are the issues that they really look at. And so this committee is very important to us. I mentioned it is chaired by Richard Raymond, who is from Laredo, and he has been a member of the Texas House of Representatives for many years. He's very knowledgeable. This is his second session chairing this committee. Naomi Gonzalez from El Paso, this is her second session on this committee. Representative Elliot Neistat has been on this committee for many years. He is a great friend, and he's very knowledgeable about these issues. Now, the other folks that are on this committee, this is the first time on this committee, Tony Rose, who actually is former CPS worker, which is very, very nice because she brings that lens to what she is doing. Pat Ballin, Stephanie Click, Scott Sanford, Scott Turner, and John Zerwas. These folks are all new to this committee. Now, Representative John Zerwas is not a new member. He has been a representative for several legislative sessions now, and he formerly was on the Public Health Committee, and he switched this session to the Human Services Committee. And he is very knowledgeable in this area. He also is the chairman of the Appropriations Committee that looks at funding in this area, so he's a very, very important person to Child Protective Services. As is Donna Dukes, who's not on this list because she's not on the committee, but she is also on the appropriations process, and she handles the budget on CPS, for all of the FPS, actually. I apologize, my computer is not wanting me to forward for some reason. Okay, so now we have, going over the legislation, we are going to turn to the Child Abuse Prevention Committees. This is their agenda just to kind of sort it out by areas, but this legislative items we're going to go over have been by the whole roundtable. Okay, so giving you a little bit of a background, and this material might be helpful for those of you who want a little bit of background about child abuse and neglect in Texas. As you can see, we are trending up. The child for pulling this information, and it lets you know that the child population, we're at 7 million. The reports of abuse and neglect that we had last year, the confirmed cases of abuse and neglect, the actual incidences, and then the number of children removed from their home. One thing that is very important to note is that we actually have data that the number of actual confirmed cases is usually about 50% less than what is actually out there. So that number on actual incidents, that's based on that data, on that national data. Ryan, I may get you to advance to the next slide. Thank you. So one of the things that we try to do is not only talk about the numbers, but also look at it from a monetary side. I mean, a lot of folks, they will readily of child abuse and how that has the potential to devastate a child and ruin their lives. But one of the other things that we've had a lot of traction with is talking about what that does to our society in terms of cost. And so the Center for Disease Control actually has talked about child abuse as being a public health issue. And there's an incredible study called the ACE study that looks at adverse events that occur in a child's life and how that has long-term chronic health complications for a child. And it's a very robust study. It's got a lot of respect. If anyone has ever not seen the ACE study, I would suggest you take a look at that. But one of the things that we're able to do is look at and see if a child is maltreated, what does that cost us in terms of fatality and abuse. And so that's what the CDC has done. If you want to look at those numbers, I mean, we're talking about billions and billions of dollars. And so that's what that does. Brian, can you please advance to the next slide? So luckily we have some information. Now this is in 2007 dollars, but the University of Houston did a study looking at the cost in Texas. And so these amounts, and they looked at direct and indirect cost, and these are what we would consider direct cost. And so you can see the total amount there in the billions of dollars. It is devastating. I mean, these are things that are preventable. And so this really makes the case for why we need to be investing in prevention. So when you look at and you see the numbers, you see the cost, you say, okay, yes, we really should be trying to prevent child abuse. But then you look at what we actually spend on child abuse in Texas prevention compared to other states, it's pretty abysmal. We are way down there in terms of what we spend on each child. Okay. And then if you look at cost versus, and these are just looking at, if you looked at the University of Houston, both indirect and direct, you come to that $6 billion figure. If you look at budget for 2011, and then you look at what was actually spent in 2010, 2011, and then that even further got cut last legislative session to what we spent in 2012 and 13. You can really see the comparison of cost versus what we're spending in prevention. Okay. So we have certain bills that have been filed by the members of the roundtable that are trying to really help with the prevention aspect. And so this is the first one. It's the Child Protection Act, and this is a bill that TexProtects brought to the roundtable. It is SB 939, and then we just got filed and got our bill number today, so that's why it's not up here with the bill number. But this is being carried by Senator Royce West, and in the House it will be filed by Representative Tan Parker. And so what it does is it requires institutions of higher education to really provide training on prevention, recognizing, and reporting child abuse. You know, we have had success the last 2 legislative sessions at the school level. We now want to expand that to institutions of higher education. Obviously, all of you have heard about the Sandusky, the tragedy that happened there. There are many children that are on our college campuses, and so we want to be able to provide those individuals on the college campuses with the ability that if they see a child that is being abused, they can understand the signs, they know how to report, and give them some tips that are at helping kind of prevent abuse. This would also The other part of this bill is looking at having schools and charter schools have a policy that coincides with state law on mandatory reporting. TexProtects undertook a survey 2 years ago to see if schools knew what the law was on reporting and actually followed it. And we were shocked to find out that there is a significant percentage of schools that knew the law, but they weren't following it. What was happening is the outcry witness, the person the child was telling the story to, or the person that had seen it, that witness is the person that's supposed to report it. That witness was coming and telling the vice principal or the counselor, and so they kind of had this informal process, and then that person was calling and reporting, and that's not the law. So what we want to do is make absolutely clear that they understand the law and they follow the law. The other thing this bill will strengthen the provision that says professional reporters have their duty to report. They cannot tell someone within their organization and have them report. And last legislative session, we were lucky enough to require all new professional staff to have training on recognizing, reporting, and preventing. And this legislative session, we want to apply that to all staff. Okay. Defining school social workers in the Education Code. This was brought to the roundtable by the National Association of Social Workers, and this one just got filed as well, so we have a bill number for it. It is HB 1698 by Representative Jessica Farrar. And so what it is trying to do is really recognize there are a lot of issues in schools and a lot of required training around bullying and child abuse, suicide prevention, teen pregnancy, drug and alcohol abuse, and those are issues that social workers deal with very frequently. Last legislative session, when there were budget cuts, many schools cut their social workers. We feel that, or the National Association of Social Workers feels that if we can define social worker in the Education Code to really talk about those things that they're supposed to be doing, and also their role in referrals and for behavioral health, identification of child abuse, that will strengthen social workers, people will understand it more, and that will be more of a benefit for children. So the next bill is enhancing the penalty for failing to report child abuse, and this was brought to the roundtable by TexProtects. In the Senate, SB 384 by Senator Corona, and in the House, Representative Pam Parker has filed it as HB 1205. And so what this does is for failing to report child abuse is a Class A misdemeanor. However, if you make a false report, that's a state jail felony. So there's no parity between those two penalties. So what we would like to do is for professional reporters only, and professional reporters are defined in the code, for professional reporters who are intending to deceive by not reporting. So this is someone that's trying to hide the abuse or cover it up, that there would be an ability for a prosecutor to go after a stiffer penalty. So they could go after the Class A, but then they could also go after a state jail felony. Because what we have found is that some prosecutors don't want to mess with misdemeanors, but if you said, this has the potential of being a state jail felony, then they may be more apt to pursue that prosecution. Okay. And the last one is another bill by TexProtects, and it is our Home Visitation Accountability Act, SB 426 by Senator Nelson. We've actually already had a hearing on this bill. The hearing went very well. There were over 51 cards in 19 organizations got behind it and supported it. It has passed already out of the Health and Human Services Committee and has gone over to the Calendar Committee. We hope to see it on the floor of the Senate very soon. What this bill does is set in place the Texas Home Visitation Program, and it really creates accountability around home visitation, making sure that we're looking at programs that are evidence-based or that are promising practice, making sure that if they are following a particular model, that they are faithful to that model so that we get those same outcomes. And it requires the Health and Human Service Commission to have a very strategic plan about home visitation in the state of Texas and making sure we are targeting the areas in the state that are needed, where this is needed. It's a very complex legislation that has a lot of really good real good material about how do you build a plan, how do you have accountability, and how do you ensure that the money that Texas will put into home visitation, that we're getting what we need. You know, one of the things in Texas in the past, you will hear are only interested in the number of families served, which is called an output measure. Really what we need to be asking, okay, what is the number of families served, but are we doing what we're supposed to be doing by serving them? So what's the outcome you're trying to get? And this is what this bill really gets to. Okay. So our next area is Child Protective Services, and this is our bills that came through the CPS Improvements Committee. We'll get a little bit of background about where we are in the CPS system, and then we'll launch into the bill ideas. So these are the reports collect and where we are. As you can see, we are trending up, and statewide intake takes over 275,000 reports last. And the number of removals has also increased. Many people, when they see this chart, they ask, how come there was such a sudden dip where we went down to 12,000? That is actually timed with, there was an appellate case called the Gates case. That was about a man that sued the department that had his children that were placed with him, had removed them all at one time. And so the results of that case set some standards in place, and it really had a chilling effect. The department, which at the time of that case, the commissioner was Carrie Cockrell, there was a memorandum that went out to all staff that really had a chilling effect, talked about personal liability, and so removals went way down. Since that time, there has kind of been a reevaluation to their approach, making sure they're consistent with the law, but you have seen removals start to rise again. Look at that number of 17,000. You need to think of it in perspective of, because some people say, God, that's a lot of kids, but you need to think of it in perspective of, we are actually at a much lower removal rate than the rest of the United States. We tend not to remove children as much as the rest of the United States, although we are starting to trend up towards to get to that average, but at this point in time, we are not. One of the things that Texas has really made a concrete effort to try to do is to put emphasis on keeping kids in the family, or having them, if they have to come out of the home, go with a fictive kin and do what's called family-based safety services. And this is where you're really concentrating on services to the family to try to make sure the kid doesn't have to be removed, or if they're with a relative, to work with the family to make sure there doesn't have to be formal court proceedings to try to remove the kid and terminate the parents' rights. We've really made a big increase in our FBSS, and that's better for kids. It's better for kids if we're able to strengthen the family and bring them to a place where they can stay in their home, because we'll have better outcomes. And as you can see, FBSS does a real good job of working with the families, keeping kids in the home and not having to have to remove them. And so when we can't reunify them, when we can't keep them in the home, one of the things that there has also been a trend nationally and in Texas is that we look for a relative to place that kid with. Kids want a connection to what they know. You know, they've had this horrible event. They've been taken from their home. Unfortunately, a lot of times they're taken from their school. It's very traumatic. They need something that they can connect with that is the same. And so there's been a big move to place with a relative, someone the child knows. And luckily, many times, if you are able to place with a relative, it's someone that lives close to where the child was at, and they can stay within the same school, which is very important. So they're not ripped out of their school and away from their friends. And so relative placements have really been on the rise, and I think that's a very good thing for children. So now we will look at the bills that are on our legislative agenda that came out of the CPS Improvements Committee. And once again, these got unanimous vote in the committee. Then they went to the full roundtable, and they have been adopted by the full roundtable. First bill is Educational Success for Foster Children. This was brought to the roundtable by the Texas Foster Family Association. For those of you who know, Irene Clements is the president of the Texas Foster Family Association and actually the National Foster Family Association. She had been getting a lot of families, foster families, outcrying to her about their foster kids and not being able to graduate, not being able to enroll in school timely, just a lot of problems around foster children in school. And one of the things that we know is that when a child moves to a new school, they are losing between 4 and 6 months of their schooling. And so you can imagine if a foster child has to move 10 times in 10 different homes, what that is doing to their education. You know, foster children, outcomes for kids that are aged out of foster care are not very good. According to Texas Education Agency's data, last year the graduation rates for foster children were 49%. That's abysmal. We have to try to give these kids a better start. We have to try to make sure that we can get them so that they have at least a high school diploma, and then maybe try to get them on into some type of college or training for a trade. So the first part of this bill, and it has had input from several different sources. One of the Texas Council Child Welfare Board members, Jean Stamp, has really helped a lot with this bill. She's been trying to go to the meetings when she can, but she really helped and did a lot of the background research on it. Also, the Supreme Court Commission on Children and Families has done a lot of work the last 2 years looking at where foster kids are in the educational system. How can we strengthen it? How can we better it for them? They have had a lot of input on this bill. We don't have a bill number yet. It is still being drafted, but we are working with Senator Dan Patrick's office on this legislation. And so the first component of it deals with excused absences. Currently, if a child has a court appointment, that is an excused absence. but other activities are not considered excused absences. And one thing we really want people to know, we don't want children taken out of school. We just don't want that. We want any appointments for therapy or anything with a visit, we would, at all costs, those should be try to be made outside of the school day. But in those instances where that can't happen and there is a court-ordered appointment, then we want that to be considered an excused absence and have, obviously, the child have the opportunity to do makeup work. Not only is that, of course, good for the child, but it is also good for the school, because if it is a statutory allowed excused absence, then the school still gets paid for that child for that day, because that's how schools make their money, based on attendance. Okay. So the rest of this bill is got a lot of parts. I'm going to try to just go over these generally. The biggest thing that we really are trying to focus on are those older kids, the ones that we're 8th grade, 9th grade and up, trying to get them ready for being able to graduate. And so this bill is trying to provide some flexibility in that area. If we have a student, and this is when a foster child is enrolled in a new school, it will be upon the caseworker or the foster parent to tell the school, I have a foster child that I'm enrolling in your school. At that point in time, the school needs to take a look and see if that child is on track to graduate on time. If they are not, they have to develop a personal graduation plan. And the other part of that is they need to look at their standardized testing that they have, see if they're on track with their testing. If they're not, then they need to provide intensive instruction for those children. Part of the flexibility to graduate deals with when you have a child that has transferred from one school to another school, and they were on track to graduate at the school they were at, but at their new school, they're not. So and this is when the child is within the last year getting ready to graduate. What we're trying to do is figure out a mechanism that would allow them to graduate under the old school, but they would take the course credit at the new school. So we're still working on that, but that's the thought behind it. And the other part is that some schools do not recognize partial credit, and that's partial credit is, a semester's worth of work, so that they would recognize the partial credit so these kids would be able to have enough credits to graduate. And those are the main components of that, and we anticipate that there'll still be a lot more discussions once this bill gets filed. Okay. So our next bill, access to CPS records for court-appointed evaluators. This is SB 330 by Senator Huffman. This was actually heard in committee this week, and Senator Royce West has signed on to this. This was brought to the roundtable by a gentleman named Aaron Robb, who is a court-appointed evaluator, and he had experienced this problem with getting records. So these are folks that are evaluating for placement in if there's a custody dispute, if parents are getting divorced, or if there's a private adoption. And one of the things that you would want if you're evaluating on where a child should go, you want to make sure that they have access to any CPS records that person may have. So if this person has been reported before